Okay, so the country that I chose to learn more about and create a health promotion program for is Senegal. And this was a really interesting country to learn about. It's one that I don't really know anything about. But it's a country in Western Africa, and it used to be a part of a lot of different European countries. They would create unions here and do a lot of slavery here until that was abolished. And all of those unions eventually broke up as well. But now Senegal is actually one of the most stable democracies in Africa. And this is because of a former president that they had. His name is Abdoulaye Wade. And he actually changed the constitution more than a dozen times to make it this great democracy. And let me actually change my slides so you can see what I'm talking about. So, the population of Senegal is between 15 and 16 million, and the official language is French. Most people here are either Muslim and Christian, and the fertility rates here are really, really high. So for every woman, there's about 4 to 5 children born, and this is because having a large family is really important to the people who are living here. But that also makes providing for a family really difficult because there's high levels of poverty. So this is due to the fact that more than 40% of the people who live here are illiterate and unemployed. And this is especially for the Senegalese women and youth. They're especially disadvantaged here. There are also a lot of infectious diseases. Here, the risk of contracting any of these is actually really, really high. A few of those are hepatitis A, malaria, meningococcal meningitis, and rabies. So, for my needs assessment, we'll start with the health issue. After researching some of the SDGs for Senegal, it was really apparent that a major health issue that's located here is the low maternal mortality rate. So over the years, it's become increasingly more difficult for women in Senegal to give birth in an actual facility. It's more common for them to give birth in a facility, but these facilities don't provide emergency obstetric care. So, like about 16% of births in these facilities don't even have this access to obstetric care. And it's also really hard for the women here to be actually transported to facilities and do have this care. So the population and regions impacted, the population that would be most impacted is obviously the expectant mothers who are living in this region, and the healthcare workers or skilled birthing attendants. One region that is affected by this is the Tambacounda region in Senegal. This is a difficult region because it's really, really rural in this area, and there aren't very many skilled birthing attendants, and the distances between public facilities is pretty far. And I also found some evidence-based practices that have shown what other programs have been done in this area. And one of those would be Amref Health Africa. And what they've done is they've actually made it possible for healthcare workers to receive training wherever they're at in their education, so that they can just continue to learn more. So they're actually able to do this on a mobile phone. and they're able to collaborate with other healthcare workers and also assess patients doing this. Another thing that's been done is by Waha International's mHealth program, and this just gives women cell phones to be able to receive mass text messages from healthcare workers, and it provides the mothers the ability to contact more healthcare workers. So the partner organizations that I've looked into would be Amref Health Africa, and not actually UNICEF. I actually wrote that wrong. That's my bad. That's supposed to be USAID. So Amref Health Africa, as I said before, they do a lot of work in Senegal to just train regular healthcare workers, and that's an excellent resource that we could use, but the one that we decided to go with was actually USAID. And this is because they do a lot of work in Senegal, not only for the health of the people, but also for education, self-reliance, employment. And so I felt like this would be just a really good organization to use because they know the area and the people really well, to be able to help in the best way that they can to fit the people's needs. Okay, so here we have my design strategy. The overall goal of the program we'd be implementing would be to protect the lives of more mothers in the Tambacounda region of Senegal. And we'd be doing this by educating 70% more healthcare workers and midwife volunteers. So more women would have access to quality obstetric care. And we would also provide 80% of the expectant mothers with phones to be able to communicate with emergency medical services when they are in need. And the two main audiences that we would focus on would be the healthcare workers or the midwives. They're key to this project because they're the ones that will be trained to take care of the laboring mothers in this region. And then the second would be the expectant mothers. And this is obviously because we want these expectant mothers to feel comfortable at this time in their lives and to also keep them healthy and safe. So for our theoretical framework, we want to focus on providing education. So because of that, the theoretical framework we would use would be Bloom's taxonomy of learning. And using that framework, we would be able to break it down to certain elements of learning, those being cognitive, affective, psychomotor. And this would just help us to best educate the healthcare workers and the mothers in Senegal. And then for our budget and implementation program, we would just focus on hiring like a project manager and then managers to also oversee the workings of each objective. And then we would also have trainers to be able to educate our skilled birthing attendants and midwives, and then also a technology specialist that would help with the purchasing the cell phones and making sure that they have the right abilities so the mothers can access the care that they need. And then because there are large amounts of women delivering babies in this region, we feel that it would be appropriate to evaluate the education and the phone communications every 8 weeks. Every 6 months we would track the maternal mortality and adjust our processes as needed. And our relevant stakeholders would obviously be USAID. They have many resources that would be really helpful to us. And then other stakeholders would be local community members and healthcare professionals. So for our team, I kind of mentioned this before, but we would have a project manager, and the main purpose of this position would be to make sure that the implementation of the program runs smoothly. So they'll oversee everything. And then another responsibility that he or she would have would be to gather the skilled birthing attendants that need to be trained and the volunteers. And then we would also have our managers over each specific objective just to make sure that things are running smoothly there. And then we'd also have the trainers to train our new skilled birthing attendants. And we would have a communication specialist just to kind of get the word out about the program that we'll be having. And they'd be doing this by flyers, technology, text messaging systems, and other things. And then our technology manager would help with the implementation of the cell phone communications. And then we would also have 2 people as main evaluators so that we can adjust our plans as needed. And then for our tools and techniques, we would focus on telling, and that would involve conferences, webinars, and workshops. And we'd also be focusing on workshops to educate and provide knowledge to train new skilled birthing attendants. And then the second tool and technique that we would be using is publishing. And this would be used to share knowledge with large amounts of people. So our communication specialist would be primarily responsible for websites and flyers and other communication methods. And then the way that we'd be able to gather feedback the best would be by using surveys from our skilled birthing attendants and the mothers and trainers, just to see how comfortable everybody feels with the way that they're learning and what would best fit there. And then we'd start by hiring a communication specialist and project manager, and then we'd be able to gather the materials that we need for other parts of our program. Okay, so for our implementation plan, we'd first focus on, we'd be holding, to make sure that everything is being carried out in the appropriate way, we'd be holding weekly meetings with each of our faculty. And these meetings we would go over what we accomplished in the previous week, as well as what we'll be doing in the following week. And we'd set SMART goals to accomplish these things. And then besides our SMART goals, we would also, in our weekly meetings, we would also use other techniques to monitor our progress, that being collecting surveys from the new skilled birthing attendants that are being trained. And these surveys would be used to collect information about how they feel their learning is going and what things we need to be adjusted to make that run smoother. And then we'd also be monitoring the maternal mortality statistics, and how many phone calls are being tracked through or being sent out from the mothers and the healthcare professionals. And then we'd obviously want to adapt with whatever we're learning from these surveys. We take what we learned and then give that to the trainers so that they could do that. Okay, so we hope by the end of this that the number of maternal deaths decreases by 80%, and we also want to have 70% more skilled birthing attendants and 85% of the expecting mothers to have cell phones so that they can communicate better. And then I'm running out of time with my video, but we would obviously, for our evaluation, I've already mentioned this, but we would focus on surveys and also a focus group so that we could measure the learning. And then we would also want to focus on measuring the statistics of the maternal mortality and the phone calls that are being sent out. And we do that just by those measures. And then when all of this is over, we want to share all of this information with our stakeholders, and then we'd publish this to a finding for a public health journal so that we could share it with others as well.